My talk today is about the committee opinion which was published in Fertility and Sterility, January 2017, by the American Academy or American Society of Reproductive Medicine. And the topic was of optimizing natural fertility. Now, what does it mean? Often patients come to us asking us, when should I get pregnant? When should I try and have sex? Can I smoke? Can I consume alcohol? Can I use lubricants? Can I have sex every day? These are questions which are often asked by patients, and we tend to give different answers. So the American Society of Reproductive Medicine set up a committee which looked at all the evidence which was present regarding these cases. And thus, under the title of Optimizing Natural Fertility, this paper was produced. So what are clinicians asked? They are often asked to produce evidence about lifestyle practices that help conception to optimize the best chance of having a baby. Now, one of the most important things is the aging process. We know that age and fertility go hand in hand, and there's a decline in fertility with advancing age. Now, fertility is defined as the capacity to produce a child. 80% of couples conceive in the first 6 months, and that is very important to realize. The first 6 months give you the best chance of conception. The probability of pregnancy is the highest in the first 3 months of trying. Also, fertility declines with age. Sadly, this is more pronounced in women than in men. We know that fertility declines in women after the age of 35, and it varies depending on their ovarian reserve. Men also face a decline in fertility, but it seems to be that till the age of 50, this decline in fertility does not seem to be affected. So if you look at this, it clearly seems that nature is not very kind to women and gives women a certain window where they can achieve a pregnancy. When you look at the graph, and if you see how the graph declines, after the age of 35, there is more rapid decline in the number of eggs as well as the fertility rates. And this is something extremely important. Science can go to a certain extent in improving the chances of pregnancy, but it does not radically alter what age does to pregnancy rates. The most important question we often get asked is, how often should a patient have sex? And we come across all different ideas, different opinions. And often we are also said that, no, a man should hold and not have sex for 5 days, 7 days, 10 days to keep the best sperm. In fact, that's the worst thing to do. Abstinence, which means no sex for more than 5 days, seems to affect sperm counts and sperm quality. In fact, it has now been proven that shorter duration of abstinence, that is 2 days, 1 day, is associated with better quality of sperm. Now, did we know that earlier? No. We said, hold on, keep those 4 or 5 days of abstinence. There is very good evidence now to suggest that shorter the period of abstinence, the better is the quality of the sperm. In fact, there was a study done of 10,000 sperm samples. And what we know from that study is the count, the motility, the concentration remain normal even after daily ejaculates. So having sex every day does not worsen sperm counts. The question is women who are trying for a baby, or couples who are trying for a baby, in fact, have been trying for such a long time that trying to have sex regularly also becomes extremely difficult. Now, if you look at the evidence of about a study of 221 couples, 37% probability of pregnancy per month if you had daily sex. If you had alternate day sex, that was 33%. 15% was a probability of having a baby if you had sex once a week. The best results are if you have sex between one every day or on alternate days. And that is something which we need to tell patients. Again, the question is, when should you have sex? Do you wait for ovulation? As soon as there is ovulation, do you hurry and have sex? In fact, evidence suggests that after ovulation, natural pregnancy rates tend to go down, they don't increase. The best period to try for a pregnancy is before ovulation, just before ovulation. The fertile window is defined as the 6-day interval ending with the day of ovulation. Remember that statement. It's ending with the day of ovulation. The best results are if intercourse occurs 2 days prior to ovulation or 1 day prior to ovulation. From the day of ovulation, pregnancy rates start declining. How do you monitor ovulation? In nature, you can do clinical monitoring. A patient can do monitoring herself to do cervical mucus, libido, pain, mood changes. These are all factors which can be used by patients, and many patients do use them. And they seem to detect ovulation in about 50% of cases. You can do vaginal secretion assessment. We know that vaginal secretions change. Ovulation and conception rates are maximum when mucus is slippery or clear. And a study done on 1,681 women showed that pregnancy rates were the highest when you had sex around the peak of the cervical mucus. You can combine it with a cervical mucus and a temperature chart and combine it. And what evidence suggests is that combining a mucus or a cervical mucus chart with a temperature chart is better than just using a menstrual calendar for patients. So if patients ask you, oh, should I do cervical mucus? Should I do temperature? I think there is an element of positive chance of pregnancy when you aim to do it. Often it is asked is, disposition of sex, does it have any impact on the chances of pregnancy? What we know is that as soon as the sperm is deposited in the vagina, within 15 minutes, the sperm starts moving. We know that there is coital position does not affect chances of pregnancy. There is no relation between orgasm and fertility, and there is no specific link between specific coital practices and infant gender. All that has been proved completely wrong. Another question which is often asked is, can you use lubricants? You have to realize that there will be some women and some couples who will have a mild psychosexual problem where sexual intercourse is painful. Now, in those circumstances, using a KY jelly or KY touch, which is available in the United States, or olive oil or saliva, seems to decrease sperm mobility and is not advised. Now, can you use any other oils? Yes, there is some evidence of using mineral oil or canola oil, or you get a new preparation, probably in the United States, of hydroxyethyl cellulose-based lubricants, and these are considered to be safe. They do not affect sperm motility, but you have to remember that a link between lubricants and sperm quality is not very convincing. The next question comes up is, what is the implication of diet and fertility? There is such a lot written on diet and infertility. What you should eat, what you should not eat. Again, let us look at the evidence. I'm not saying that diet does not have any role to play. We know that fertility rates are decreased in women who are extremely slim. They are also reduced in women who are very obese. If there are irregular periods and if there is anovulation due to increased weight or decreased weight, fertility is affected. They have looked at different diets, and the diets are vegetarian diet, low-fat diet, high-protein diet, herbal diet, and antioxidants. Evidence suggests that none of these seem to affect fertility. We then come to smoking. How much should you smoke, or do you smoke? There is no doubt that smoking will affect fertility. There's been a study of 10,928 women who are smoking versus 19,128 women who are not smoking, and there is evidence that smoking reduces the chances of pregnancy. On the NHS, a large number of funding is linked to smoking, and smokers are not given funding. It is also known that women who smoke have their menopause 1 to 4 years earlier. Smoking also increases the risk of miscarriage, and in men, there's good evidence that smoking reduces density and motility. Though when you look at whether it is linked to fertility, the evidence is limited again. Next is how much alcohol do you drink? Do you drink alcohol at all? Surprisingly, there is limited evidence of the link between alcohol and fertility. There is some evidence coming up that if you drink more than 2 drinks a day, fertility rates may be affected, and it may be better to drink about just 1 drink a day. In pregnancy, it may be better to avoid alcohol altogether. With men, that link between alcohol intake and sperm quality in moderate proportions doesn't seem to have any difference, and we still do not know. High intake of alcohol does affect sperm motility and also the ability to have sexual intercourse. What is the implications of taking drugs such as marijuana, cocaine? And it should be discouraged because there is a significant factor that seems to lower fertility. And when we look at environmental factors, and these are factors which are looking at, is there an impact of sauna, hot baths? There doesn't seem to be any link of decreasing fertility in women, and it does not seem to decrease sperm counts in men. So, you stop going to saunas or hot baths. Again, the evidence is not there at present. There is more and more evidence coming up of environmental pollutants, and this is something which will change the way we look at medicine. The environment does have an effect on us. There's also good evidence that the environment is changing our health patterns. It is changing how we respond to certain ailments and diseases. And we know that exposure to environmental pollutants is a potential cause of infertility, that dry cleaning agents may be a cause, chemicals in the printing industry may be a cause, and pesticidal exposure may be a cause for infertility. So in summary, what I would suggest is, there's a fertile window. That fertile window ends with ovulation. It does not start with ovulation. It is good to advise that a couple should have a regular sexual intercourse, probably once or twice a day after the period ends. Coital position does not matter. It does not matter taking rest for 1 hour or 2 hours. Moderate alcohol intake is advisable. Excess alcohol intake should be avoided. Smoking should be avoided completely. Regards to coffee and caffeine intake, no more than 3 cups of coffee a day is generally advised. And that is coming up from evidence. Thank you very much. I hope this has given us some areas to think about of what the advice that we give to patients. Thank you.